So good day, I'm Adrian M. Zamani. I am a Original Guillermo. And today we are performing bed bath and bed making.
First and foremost, bed bath. Step number 1, sanitizing and gloving. Before doing the assessment and touching your patient, it's important to do hand gloving and sanitizing to avoid any contamination and also to avoid the spread of virus to the nurse and to the patient, vice versa. Step number 2, verify your patient and assess. Introduce yourself first and then verify the patient's name, age, and birth date. After so, assess the patient for any pain and discomfort and any aspects of health that may affect our bed bath. After assessing, don't forget to explain to the patient your assessment, which is the bed bath. So why is bed bath important? It is important to cleanse the patient and remove any bacteria from the patient's body and also to help the patient refreshen up for a bit. Place the bath blanket over the top sheet. If your client is conscious, ask your client to grasp and hold your towel up. But if your client is unconscious, you can ask for any family member for help. After that, you can proceed in moving your top sheet. After removing your top sheet, you can proceed in removing the client's gown, but make sure to provide privacy for the comfortability of your patient. So the first thing that the nurse will wash and bed bath is the patient's face. So first and foremost, place the towel under the client's head. After that, wash the client's eyes with water and dry them well. After that, use the separate corner of the washcloth for each eye. Then wipe from the inner to the outer canthus. After that, ask whether the client wants soap used on their face. And then wash, rinse, and dry the face, ears, and the neck. Remove the towel from under the client's head. Next is washing the arms and the hands of your client. First, place a towel lengthwise below the patient's arm, and then wash, rinse, and dry the arms by elevating the client's arm and supporting the client's wrist and elbow. Use long and firm strokes. Always remember, wrist until the underarm. Apply deodorant or powder if desired. Special caution is needed. Place a towel on the bed and put a wash basin. Place the client's hand in the basin for soaking. Assist the client as needed to wash, rinse, and dry the hands, paying particular attention to the spaces between the fingers. After that, pat dry and proceed to the next step. We are proceeding with washing the client's chest and abdomen. First, place bath towel lengthwise over the chest. Fold bath blanket to the client's public area. Lift towel off the chest and bath the chest and abdomen. Give special attention to the skin folds. So as I said, let the patient hold your towel if conscious. If not, ask the family member if they can assist. Next, rinse and dry well. Replace the bath blanket when the areas have been dried. Wash the legs and feet. Expose the leg farthest, being careful to keep the perineum covered, and then pat dry. The last step of the bed bath is washing the back and then the perineum of the patient. Assist the client into a prone or side-lying position. Place the bath towel lengthwise alongside the back and the buttocks while keeping the client covered. Wash and dry the client's back, paying attention to the gluteal folds. Remove and discard the gloves if used. Perform a back massage now or after completion of the bath. Assist the client to the supine position and determine whether the client can wash the perineal area independently. If the client cannot do so, drape the client and wash the area. Last, after ending our bed bath, help the client put on a clean gown or pajamas. Assist the client to care for hair, mouth, and nails. Some people prefer or need mouth care prior to their bath.
Second and foremost, bed making. In this procedure, we will demonstrate the proper technique for making an occupied bed, ensuring patient's comfort and hygiene. This procedure minimizes disruption to the patient while maintaining a clean and safe environment.
The most important thing in starting bed making for the patient is to ensure the patient's privacy. First, place a towel on top of the patient and ask the patient to hold the towel if conscious. If not, you can ask the family member to hold the towel while you proceed in your bed making.
Now, we will loosen the top linen. Carefully loosen the top sheet blanket and spread, avoiding any sudden movements that might startle the patient.
After removing the top sheet of your patient, make sure to dispose it properly in the hamper. After that, we would be proceeding with the next step.
With the help of other nurse if needed, gently move the patient to one side of the bed and support the patient to ensure their comfort and safety throughout the process.
After assisting your patient to the side, you can proceed in removing the dirty sheets or decontaminated sheets. First would be the bottom sheet, the rubber sheet, the fitted sheet, and the patient's top sheet. After that, roll it to the side and clean the bed with your sanitizing kit, such as your clean mitten towel and also your alcohol.
Now, we add the clean bottom sheet. Place it nearly on the bed, ensuring it's centered and tucked in at the sides. This step is crucial for maintaining a smooth and wrinkle-free surface. Next, the fitted sheet. Ensure it's properly fitted to the mattress. Tuck in the clean bottom sheet around the mattress, ensuring it is smooth and wrinkle-free. This creates a comfortable and hygienic sleeping surface.
You would want to make sure to do the same thing on the other side of the patient. Gently flip the patient on the other side and you can proceed in finally pulling all the dirty sheets and dispose it on the hamper. After that, clean your bed by yet again sanitizing the bed and gently wiping it with your towel. After removing all the contaminated sheets, you can finally replace your bed with clean ones, such as your bottom sheet, next is the rubber sheet, and lastly, your fitting sheet.
Now, clearly move the patient back to the center of the bed. Place the top sheet and blanket over the patient, ensuring that they are comfortably positioned. Finally, make the bed neat and tidy, ensuring all linen is smooth and wrinkle-free. Place any personal items within easier reach. And before leaving, conduct a final check. Ensure the patient is comfortable and has everything they need. Confirm all equipment is functioning correctly.
So now we're done with both bed making and bed bath. So that's all.